Okay, hi everyone. Welcome. I'm going to get us started. Welcome to the first program of 2026 for Harvard Alumni for Global Women's Empowerment. It's a great start to the year. I know it's been an eventful few weeks in a lot of places, and I just wanted to acknowledge that some of us are facing some difficult challenges, and we want to make sure that we're also here creating a space for mutual support and dialogue. If this is your first GlobalWE event, welcome. And for if you've joined us before, welcome back. Really excited to have everyone here. As I mentioned earlier, please feel free to share your location in the chat so we know where everyone is dialing in from. I am Rupal Thacker. I'm the program's chair as of November for Harvard GlobalWE, and we are a shared interest group of the Harvard Alumni Association, the HAA. And under that umbrella, our opportunities, programs, and volunteer opportunities all have to comply with HAA's community expectations, and that includes respecting the rights and differences and dignity of others. And so all of us taking part here today are expected to demonstrate honesty, integrity, and civility in these activities and be accountable for our conduct. And GlobalWE reserves the right to exclude from participation any person whose behavior adversely affects safety or well-being or inclusion of other community members. Harvard GlobalWE is dedicated to the empowerment of women through education and through dialogue, as well as through connection across individuals, among individuals working across the world, working for women's rights and freedoms. We highlight awareness and we raise awareness about issues concerning women's empowerment, including, not limited to, but our five major themes are education, political rights, freedom from violence, women's health, and economic environment. And we also have a global board of directors with representatives in the US, Canada, Asia, Africa, Europe, and the Middle East. And hopefully you'll meet at least one of our board members later on in our smaller groups. So today we're here to hold our fifth event in our Discussion Circle series. Discussion circles are designed to bring us together to just talk about current and pressing news items in a timely and thoughtful manner. So we're here really to create space, as I mentioned earlier, for respectful dialogue on pressing topics of the day. Previous discussion circles have covered women's protest in Iran, the impact of the war in Ukraine on women, where we specifically focused on the psychological effect of forced migration, sexual violence as a weapon of war, and terrorism, as well as the impact of ongoing conflicts on women's basic needs. So you can see that we cover some pretty hefty topics here. And today we're going to hear about global aid cuts and the impact on women and girls, first through the perspectives of a few speakers, and then followed by informal discussions in the breakout rooms. I'm going to start now by introducing our moderator for the event, who will then introduce our panelists. So please join me in welcoming Aarti Gupta, who's the Vice President of GlobalWE. Welcome, Aarti.
Thank you, Rupal. Hello, everyone, and welcome. I am honored to moderate today's discussion on the topic Global Aid Cuts and the Impact on Women and Girls. Here is the format for this event. First, we will have presentations and a panel discussion for about 35 minutes. Next, we will have several rounds of small group discussions, which Rupal mentioned are breakout rooms, followed by closing remarks. Before we begin, I would like to share a few notes for the discussion, which will also be included in our chat. These are certain ground rules which we expect all our attendees to follow. Themes and broad ideas can be shared after this meeting, but personal stories stay within the room. The discussion group portion of this event following the panel discussion will not be recorded or shared in any way. Please share airtime and share responsibility for the group's success and well-being. Treat participants with respect and consideration. A diversity of perspectives is an essential part of the process. Everyone has come here to learn, to grow, and to share. So, does anyone have questions or concerns about these rules? I'm sure, I hope not. Thank you. Now, I would like to welcome our panelists for today. Our first panelist is Noof Asi, specialist in gender-based violence in emergencies. Our next panelist is Stephen Bloomstein, president of Turmicure Foundation. And our final panelist is Dr. Malika Glover, senior public health leader, social epidemiologist, and global peace and security practitioner. Thank you. Welcome, everyone. And we're so happy and glad you could join us here. I know we're still sort of setting in from the holidays with just being first few days of January. First, I would like to request each panelist to please introduce yourself and share more information about your work, including your research, expertise, and perspective on the impact of global aid cuts on women and girls. Can we start with Dr. Malika Glover, please?
Sure. Good morning, good afternoon, good evening, depending upon where you are in the world. My name is Dr. Malika Glover. I'm a social epidemiologist. My work focuses on women, peace, and security, public health and security, policy, and community infrastructure, um, and really concerned and focused on vulnerable populations for most of my career. So that continues from that perspective. I'm really excited and honored to be here today. So I want to first start by saying thank you for inviting me to be part of such an important discussion. I really appreciate the opportunity to contribute from a public health and systems perspective to such a critical conversation. I'm really excited to be here on this panel with my other two colleagues in this space. We are going to, I know, attempt to ensure that we don't, we will overlap in some respect, but I will try to stay sort of in the public health and security space. But my main three things as far as this conversation is concerned is that global aid cuts really are a threat multiplier when it comes to women's health and security. They roll back progress for women and girls, and they very much disrupt the investments that we make in women. And so all three of those things are really important from not just a safety side, but also public health and systems infrastructure in general. So again, thank you so much. I look forward to having more conversation around this and really excited about the breakout rooms.
Super. Thank you, Dr. Malika. Noof, would you like to go next, please?
Sure. Morning, evening, everyone. My name is Nof Asi, and I am gender-based violence and emergencies specialist. I'm coming from the field, so that's where my focus is. I'm normally is part of the first responders who, whenever there is an emergency, we set up a programming to support women and girls survivors or at risk of facing gender-based violence, where it's unfortunately it's most of the time is often happening within emergencies. And I'm really honored like to be here with my fellow panelists and with everyone. And what I want to focus on like today in our discussion is that like when we talk about funding cuts, we are like not talking, we normally is like listen to it, hear about it in terms of numbers, efficiency, and trade-off. But when I come from in the field, what I want to start with is that aid cuts are not neutral. They are like the ones where risk starts. The most dangerous assumption is that like gender-based violence or protection programming is the one that like we are unessential. Normally, when we are trying like to reduce funding or reduce expenses, we close these kind of services. But what does that mean in reality? That means that protection and gender-based violence are the entry point. So we are cutting some funding to allow other programming to be available and to be around. But that means we will have, for example, food distributions, we will have WASH programming, and we will have clinics, but we will not have the safe entry points for them. They will be functional, but women and girls will not be feeling safe like to access them. What does that also mean? That will means also women and girls who are survivors, they are going to feel betrayed. So we are cutting the protection or cutting like the trust between us. And as aid workers, when we come back again and try like to build that trust, we're going to lose that efficiency. We are not be able like to be trustworthy by clients. And I'm looking forward like to have that discussion. And yeah, thank you so much.
Thank you so much, Noof. And we're also looking forward to delve into some deeper thoughts and insights about these questions, right? Can I please invite Stephen to sort of take stage and talk a little bit about his work and what he does?
Hi. So I'm Stephen Bloomstein, and I co-founded and president of the Turimekire Foundation, which works in northeastern Venezuela along the Caribbean coast. And our story, we are a very grassroots foundation, but our story is kind of backwards. Some North Americans, after we got out of college, decided to move to Venezuela and fruit farming. And we went into this very remote rural community. When I say remote, I mean 2, 3 hours walking off the road to even get to where these people are. No social services or anything. And began a relationship with them. And they taught us how to live and survive in their world. And we offered them some education and some support. And the women came to us and asked us specifically and very directly for family planning. And that was how our foundation began. It actually began with the death of a woman we knew well, giving birth to her seventh child, 3 hours up the road in this remote mountain, and she didn't survive the birth, nor the child did. And we had already been working a little bit, but this was like the motive which propelled us to actually do something broader about it. What I can talk about is what it's like in places where women and families do not receive foreign aid or any kind of global aid. And in poor, lesser developed countries, we're talking about women with averages of 10 or more children, several infant deaths, 15 or more pregnancies. When I asked one woman, I remember when we started, and I asked one woman when was her last period because we were trying to figure out how to get to her in family planning. She said 7 years ago. She had been giving multiple births, and there have been studies which have shown that in pre-industrial times, women had like a total of 19 periods in their whole lives because they were constantly either pregnant, giving birth, lactating. And so our foundation started in 1997 and gradually began to make an impact. And in the local communities where we work, we really changed that panorama. Then Venezuela went into, and I'm sure everybody's heard about Venezuela, humanitarian crisis. But we have been able to maintain in our area a certain profile of reproductive health. And that is the contrast between having some kind of global aid come in. We're very small and we're not USAID or anything, but having some kind of global aid come in and when people are just left to survive for themselves. So that would be my contribution today.
Thank you. Thank you so much, Stephen, for sharing that background and for grounding us in the journey behind your foundation. I'm sure the work your organization does in supporting communities and family planning area with consistency and care adds a very practical perspective to this conversation, which we're very excited to sort of move ahead into. So as next part of our program, before we move into breakout rooms, I do have a couple of questions for each of you. If I can request everyone to add the rest of the panelists. Thank you. I'll start with Noof. Noof, data from UN agencies shows that during humanitarian crisis, rates of gender-based violence increase by as much as 20 to 30%. While reporting often declines due to fear and lack of services. From your experience, when aid is reduced or delayed, what are the first protector systems for women and girls that begin to fail? And what risks does this create in real terms?
Yeah. I mean, when humanitarian aid reduces, we will see, like, especially for protection programming for women and girls, the first thing that fails is the human interaction, the human services. So what we will see is like the first thing that will fail is the women and girls safe spaces. These are like not just like a space for people to hang out in, but it's a space where women can interact with peers, can receive different kind of services, can receive information, can be heard, can receive safety planning, action planning, as well as safe entry to other services. So this is like, it's not a space for let's say, doing recreational activities. It's much more further than that. That's one. Survivor-centered case management is one of the things that like nobody have interest in or think about, because it's a really minimal kind of funding, but it has a huge impact on women and girls, especially on survivors. I still remember we had normally in different locations for the safety of women and girls, we embed these services within hospitals. But when we had to cut our funding, we reduced the funding for having the room for case management. In Syria, I still remember we had a survivor that is coming in, not to report a service, but she was asking about where is that room? Why it is closed. When we told her that we had to cut it because our funding was reduced, she walked back with silence. That silence does not mean that she is satisfied with the answer. That means that silence will be her new protection method. She will be having new coping mechanisms. And when we see bad coping mechanisms within the communities, especially in emergencies, that means harmful acts against self. That means early marriage. That means survival sex. That means bad coping mechanisms. And funny enough is that any other kind of services you can pick up later in emergencies, right? But when it comes to dealing with sexual violence survivors, you cannot come back later. You cannot come at later stage and tell them, let's start the service because we have the funding at the moment. We get the breather at the moment. It should be is treated as an emergency, it not should be treated as a complementary, because as I mentioned earlier, that when we talk about other kind of services, yes, we have functional clinics, we have functional food distributions, we have functional other safe spaces, shelters, education. Yes, they are there, but are they safe for women and girls to access them? Do outreach workers are there, like to do community mobilizations to make people understand the rights for girls, like to access education? That all comes with the protection programming. It's minimal, it's nobody can see, but it has a huge impact. Other than that, when we talk about cutting the fund, we see less reports of violence. That does not mean violence has vanished. That means it just like not being reported. That just means survivors decided to stay silent and not talk about it because they lost the trust. That we spend lots of time as experts in protection programming to build the trust with the community, to have mobilizers to work within the community, to be the eyes and ears of these women and girls, to let them know about these services, to let them know about their rights, to let them know what they can receive in a safe way. But when that is lost and it's minimal funding and it's like, let's say, accessories programming, all this disappears. So we will see lots of functional services, but not safe for women and girls.
So excellent points, Noof, and what you've highlighted is critical. These spaces are often misunderstood as optional or recreational, when in reality they are foundational to safety, access to care, and dignity for women and girls. And when they disappear, we know that risk increases immediately, even if it's not always visible, right? Often we misunderstand the decline in numbers, like you said, but it's really not a decline in numbers, but just them being silent. So,
Decline reporting.
great.
Yeah.
Absolutely. Building on that, I'd like to turn to Dr. Glover, Dr. Glover, from a public health perspective, we know that women's health outcomes are deeply tied to system resilience. The World Health Organization estimates that disruptions to basic health services can lead to tens of thousands of additional maternal and preventable deaths annually in fragile settings. How do aid cuts today translate into long-term public health consequences, especially for women? Particularly if you can give a perspective 5 or 10 years down the line.
Sure. So, in full disclosure, I do work at the Centers for Disease Control. So, I just wanted to make sure I said that. But at the same time, my comments, my perspectives, all of those are of my own. And this is really important to me because as a public health professional for such a long time, public health is being actively dismantled. And it's really more important than ever that we really continue to focus on the public health aspect of what's going on. So I just wanted to say that first. But from a public health perspective, AIDS cuts don't just reduce services, they literally alter the trajectory of women's health. So women's health outcomes, especially maternal health, as you mentioned, are among the most sensitive indicators of systems resilience. And so when funding is disrupted, the first losses that are usually seen are preventive and continuity services. So such as prenatal care, contraception, skilled birth attendants, supply chains, as well as community outreach. And so those losses don't just show up immediately as a single crisis, they show up down the line as accumulated risks. So first, what we see is health worker erosion becomes permanent. So midwives, nurses, community health workers may be difficult to retain, many won't return, and training replacements take a lot of time, weeks, months, years, whatever it might be, to replace those women who are in the community and supporting the health of these women. And so that creates a long-term capacity gap. And second, preventable risk compounds. So fewer women receive consistent prenatal care. Nutrition is not prioritized for mom nor baby. Critical preventative measures such as childhood vaccinations are not maintained. Chronic conditions go unmanaged, and high-risk pregnancies increase. So this raises the maternal and neonatal mortality rate well after the original funding cut has initiated. Third, girls and adolescents absorb delayed harm. So cuts to sexual and reproductive health services lead to more unintended pregnancies, educational disruption, and unsafe care. And so outcomes that shape women's health, economic participation, as well as autonomy, which is equally as important for the next decade. So finally, Noof brought this up, trust. Trust erodes. Once women experience health systems as being unreliable, utilization drops. And it may continue to drop over time. And so even when funding is restored, it can take years to rebuild that confidence for access. And so the bottom line is that aid cuts don't just pause progress, they reset women's health to a lower baseline, making future gains slower, more expensive, and less equitable.
Great point, Dr. Glover. What you're describing makes clear that aid cuts don't just create gaps in services, they fundamentally change life trajectories. And the fact that the earliest losses are preventive and optional services and that their consequences surface much later, especially important. And I think because the consequences are not immediate, they're often overlooked, right? So with that in mind, I'd like to bring Stephen into the conversation. Stephen, from an implementation and foundation standpoint, we often hear that philanthropy or local actors can fill the gap when aid is reduced. At the same time, research shows that less than 25% of global aid is directly channeled to local organizations. From your experience, what trade offs do community based organizations face first when funding contracts?
Okay. Yeah, first I would argue from our own experience and observing others that local community-based foundations are often the most efficient way to deliver services, including reproductive health services across the board. So, and they are the first to receive funding funds. In our case, we were not depending on USAID as one example, but the funding panorama became much more competitive. We were all of a sudden everybody were desperately looking for funding, and we had to find someplace in there to maintain our own programs. Second, I would really like to reinforce what Dr. Glover just said on every aspect of what happens when you cut funding, because that's our, very direct experience. And in particular, what I would emphasize is um, the you begin to lose staff. You begin to lose people who have been dedicated and committed to this, wonderful work, and they can't survive if you can't keep them, adequately compensated. And you're talking about years and years of experience and people being channeled and having to do other things which don't take advantage of their best talents and so forth. We our little foundation in Venezuela is very little. We actually maintain and support and make a significant contribution to the survival of several clinics and any number of doctors and field workers and so forth. And when you constrict this funding, the whole infrastructure begins to collapse and begins to, or at least contract. And the very first thing that happens is that, as we've been saying here, is that women and children pay the first price for this because the services that are necessary for them to have healthy lives and become diminished. And the other thing that it really percolates down the line because they have less education, they're less able to become independent, autonomous people. The consequences are just immense. So, and when we face that, we just do everything we can not to cut back our services, and above all, not to cut back our staff. We just find some way to keep our staff alive and functioning. So that in a better time, if a better time comes along, we will be able to pick up with all the expertise and all the experience that we've accumulated over the years and just pick up and keep going. We've been through several cycles of that over the years, and in Venezuela is a really a place where it all happens very dramatically. So, we have some experience with that.
Thank you, Stephen. What you've described sort of reinforces what we've heard earlier as well, right? When funding contracts, it is not just programs that are affected, but the human infrastructure that holds systems together sort of breaks down. And it's interesting to hear how you sort of, with your foundation, managed to keep the most important, crucial part of foundations, right, which are its people, the trained staff, which is very difficult to sort of, and takes years of progress to sort of build back upon. So that's an interesting perspective. Noof, I would like to ask you the next question. Gender-based violence prevention is often framed as secondary to food, shelter, or medical aid during funding constraints. I know you sort of mentioned this earlier as well. Yet, evidence consistently shows that violence undermines all recovery effects. Why is treating GBV as non-essential during aid cuts not just ethically problematic, but also, operationally flawed?
Yeah. I mean, treating GBV as non-essential during aid cuts is not ethically wrong. It is operationally fluid because it undermines every other humanitarian intervention. For example, it's like I'm currently in Darfur, so I'm going to take Darfur as an example a lot. It is one of the emergency contexts that got really affected by the cuts last year. When GBV services are reduced, women and girls often unable to have safety access to other services, right? As we mentioned. And due to fear of violence, to fear of harassment, exploitation, along the routes, like you can name it. It's lots of risk women and girls can take. And mainly at service points, right? This is like the trend that unfortunately we normally see during emergencies. That means as this assistant exists on paper, but not in practice. So GBV prevention and response are therefore enablers to access and not option add-ons. When the protection system weakens, families resort to negative coping mechanisms, as I mentioned. They have different negative strategies. And you can name the many different negative strategies that normally women and girls always face because they are the most vulnerable. And that's why even during emergencies, currently what we are now responding to in Darfur is the conflict related sexual violence. And when it comes to that kind of sexual violence, you need to treat it immediately in terms of psychosocial supports, in terms of health services, because other than that, the whole system will deteriorate. The whole community system will deteriorate. Currently what we are seeing, for example, we are seeing lots of untreated rape survivors, pregnancy out of rape. All these things, if they are not having the proper programming, that will lead to another emergency and another emergency. And we could have like just easily reduced that by having a program that is essential, that is labeled like by others as not essential, but it's like purely essential, purely is like letting other services work. And yeah.
Yeah, absolutely. I think what you're underscoring is that when safety is compromised, access to every other service becomes theoretical, right? Like, I mean, like you said, it's on paper, but if girls and women are afraid of violence or harassment, they'll not be able to access healthcare, like, or anything else which is essential on paper and is available to them, but suddenly becomes just accessible on paper. So that's why it makes clear sense for treating GBV as essential and not as one of those, secondary uh, things in place. My next question is to Dr. Glover again. Dr. Glover, research from global peace and security studies shows a strong correlation between women's health indicators and long term stability. Countries with poor maternal health outcomes are significantly more likely to experience prolonged instability. How, in your opinion, do aid cuts in health and social systems quietly increase security risks over time?
Yeah, thank you for that question. I think we don't often think about public health and security together, but this is really clearly where they intersect. So, women's health indicators, and we've already been talking about specifically maternal mortality, are consistently correlated with long term stability. They reflect whether institutions can really deliver basic protection and care. And so, aid cuts increase security risk in three, I would say, quiet but powerful ways. So first, they weaken social legitimacy. So when healthcare systems fail women, particularly during pregnancy and childbirth, it signals that the states or the countries cannot meet basic obligations. So again, that erodes trust, increases grievances, especially in fragile or post-conflict settings. Second, aid cuts intensify household level stress. So that aggregates into societal instability. So poor maternal health increases poverty, caregiving burdens, school dropout, and gender-based violence. And these pressures, they don't remain private. So it's not just going to happen inside the household. They shape labor markets, migration patterns, and quite frankly, social cohesion. And so we saw this a great deal during COVID. So third, I would say they reduce resilience to shocks. And so underfunded healthcare systems have less surveillance capability. Again, we've seen this during the last several pandemics. They weaken referral networks and fewer trained responders are consequently available. So when the next crisis hits, weather conflicts, climate shocks, other outbreaks, whatever it might be, women experience again higher excess mortality and communities destabilize faster. Women tend to be very critical to the stability of communities and their households. And so, from a security lens, this matters because fragile systems don't fail loudly out first. So you don't see it initially. They fail quietly until instability becomes really entrenched and far more costly to address. And so at the end of the day, aid cuts to women don't just increase mortality, they increase the likelihood that instability becomes chronic, whether versus being recoverable. And so what that means is that before we even get to the political ramifications connected to both aid and cuts in security, it really has a significant impact on women and girls. And the fact that since they, sort of feed the foundation of the community and the household, once that's disrupted, then all of these other things then follow suit.
Super. Thank you, Malika, for that. And, I think what you've outlined makes clear that aid cuts quietly erode the social contract which exists, right? When health and social systems, like you said, weaken, states struggle to meet basic responsibilities, and that failure shows up in broader societal insecurities. And while these may not be immediate shocks, they're slow moving risks that accumulate and destabilize communities and eventually countries. Building upon that, Stephen, my next question is to you. There is a growing push towards aid localization, which many see as a solution during funding pressure. At the same time, localization without adequate resources can transfer risk downward. Where does localization genuinely strengthen impact, and where does it risk becoming a way of shifting responsibility without support?
Yeah. So we are a very local organization, and localizing aid makes a lot of sense to us. And as I've said before, I think that small local organizations are probably the most effective way, especially because they're very integrated in the communities they work in, so that the populations that we serve really know who we are, and we're not foreigners coming in from somewhere else to impose also our other values possibly and so forth. So I think that the concept in theory is really good. The problem is, how does it work? How do you support local uh, community organizations? And we haven't had our funding comes basically directly from foundations and individual donors in the States. But what we have seen is that when big international aid organizations come into our area, and um, which they have in Venezuela, even during the most difficult years, or perhaps mostly during the most difficult years, how do they interface? How do they work with local foundations like ourselves? And we haven't had a lot of cooperation. They either politely ignore us when we reach out and say, hey, we're here, you can reinforce us, we can work together. They either politely ignore us, or if they invite us to participate, they then inundate our staff with endless paperwork and contracts and all kinds of legalese and stuff, and kind of excessive surveillance of the accounting and everything. And our staff ends up pulling back, not wanting to work with them because, and I have, I'm talking very specific experiences with very specific organizations, which I'm not going to name, but so it's been quite disappointing. That I would say I would want to emphasize, how is that interface going to work? And I feel that we could have offered so much to these big organizations. They come in, they have their own agendas. And frankly, we also felt that some of them exploited the local labor pool. They exploited people who were in real survival situations. They exploited them with their own agenda. So I, I think that while theoretically it's a great idea, you know what they say, the devil is in the details. How does it work? Can we get these big international organizations who don't directly fund us, and the ones that directly fund us have been wonderful, but the ones who come in with their own agendas, how can we work together? So that would be my main observation about that issue.
Sure. Thank you, Stephen. What you're highlighting is the difference between localization in principle and localization in practice, right? And thank you for sharing your experiencing and sharing insights about how the lack of cooperation between large international actors, which also have come in with the best interest, right, and local organization, if the cooperation does not exist, it can undermine effectiveness, especially in the most difficult context. Appreciate this first-hand sharing of experience of that. Before I close, I see we are almost running out of time for me to ask questions. I do have one final question for all of you. So, if you were advising a global decision maker working under real fiscal constraints, based on evidence from your field, what is the one assumption about aid cuts and women's outcomes that most urgently needs to be corrected? And what is the one data point or reality they should not ignore when making these decisions? We can start with Dr. Glover.
Sure. So I would say the one assumption that really needs to be corrected is that aid cuts to women's health create short-term savings without long-term consequences, because it's very clear that that's false. Cost of maternal health, reproductive health, community-based services consistently generate higher downstream cumulative costs through emergency care, humanitarian response, loss of life, and prolonged instability and lack of social cohesion. So what looks like some savings now in this budget cycle then becomes a liability in the next. And I would say the one reality decision that decision makers should not ignore is that maternal mortality is not just a health statistic, it is a systems warning light. When maternal deaths rise, it tells us that infrastructure and systems are failing. And so if you want one data anchored reality to carry forward, countries that fail to protect women's health pay for it now and later.
Thank you. Thank you for sharing that, Noof.
I would say the most urgent assumption is that that needs to be corrected is the belief that protection GBV programming funding only reduces services, not outcomes. I mean, field evidence shows that the opposite. Protection funding is cut, harm increases, even if other services are available. But protection funding is cut, then that means like the harm is increased. The coping mechanisms are becoming more negative. Women and girls have fewer services that they can access to, fewer choices, higher longer term costs to recovery. The one reality decision makers should not ignore is that when GBV services are reduced, reported cases go down while actual violence goes up. We constantly see that during finding gaps, disclosures drop, not because violence has decreased, but because safe spaces closed, caseworkers are not there. And women no longer trust the system, no longer trust aid workers. And the silence, like normally it's misread as stability when it's actually a warning sign of escalation risk. So under fiscal constraints, the question should not be, can we afford to fund GBV response? It should be, can we afford consequences of not funding it? Because evidence from the field clearly says like cutting protection does not save money. It shifts cost into violence, trauma, and field recovery.
Excellent point, Noof. Stephen, your thoughts on this?
Okay, so I would urge global funders to really emphasize, to the extent possible, family planning. Because family planning, when women and families can control their fertility, has enormous consequences for maternal and infant mortality and morbidity. It completely affects, and also in terms of some of the stuff that Noof has been talking about, gender violence. We see that when young people become inadvertently pregnant, unintentionally pregnant, the couples often have, let's call it gender violence issues, when they're feeling under pressure with a responsibility they cannot possibly deal with, especially in a country like Venezuela, where 80–90% of the population is devastatingly poor. There are no margins for anything. So that would be my first point of emphasis, that family planning has an enormous umbrella effect over many other aspects of reproductive health. And my second would be act locally, think globally. Support us, the local people on the ground.
Great points on that, Stephen. Act locally, think globally. That's great. Great, thank you, everyone. What today's discussion makes clear is that aid cuts are not just budgetary decisions. They are structural choices that redistribute risk almost always onto women and vulnerable communities. The data tells us this, field experience confirms it, and yet these realities often remain invisible in decision-making rooms. At Harvard GlobalWE, our role is to surface these connections thoughtfully and responsibly. By grounding conversations in evidence and lived experience, we contribute to a deeper understanding of what women's empowerment truly requires, especially in times of constraint. Thank you, Malika, Noof, and Stephen for bringing clarity, rigor, and honesty to this conversation. Everyone, please join me in thanking the panelists who have shared their expertise with us on such a complex but urgent topic.
Great.
Welcome back, everyone. My name is Dr. Stara Borska. I'm the Vice Chair of Programming for Harvard GlobalWE. It has been such a rich and engaging time together. To begin this final portion, I would like to invite our speakers to offer brief closing reflections. So please share one insight from your breakout room, something meaningful that surfaced, or an action you feel inspired to take moving forward. So Malika, can we start with you?
Yeah, sure. This has just been such a rich conversation and I have thoroughly enjoyed it. And I would say there are so many just nuggets. I was taking notes while everyone was talking and I learned so much. But I would say that, as a social epidemiologist, I think I'm pretty mindful of making sure, I think about who else needs to be in the conversation and dialogue and at the table. But today made me think about that even more, from multiple levels, about things that maybe I assume that other people know and have thought of when we're having these conversations and may not have the language, the collective language to use. So I am really going to be much more mindful of that, much more mindful of thinking about cross-sector language and conversations and dialogue, but also really focus on all also across generation. I think that's important. New students, new people to this space, people have been in this space for a while. I think all of that is really key and important. We talked about mental health. We talked about sort of the God complex of the United States and sort of what that looks like. But for me, it takes me back to humanity, human centered politics and policies, and really sort of understanding. Someone brought up social progress, but that we really are clearly on what have the same goal in mind. We really are on the same page when it comes to women and girls being important and what that means, in how global aid and disruption of global aid, local aid, disrupts that process immediately and long term. So I'm just looking forward to many more conversations. I will drop my email in the chat again. Whoever, anyone is welcome to reach out, to continue this conversation, talk about projects, whatever the case may be. But I just wanted to really have a heartfelt thank you to Harvard GlobalWE, to the board, and to the members, and to our guest here on the call today, for joining us in this important conversation. So thank you.
Thank you, Malika. Noof, would you like to go next?
Sure. I think it's like one of the things that I was interested in is having a discussion with colleagues who are like working in the same field, but also in the same time seeing other organizations, other advocates, other fields as well, other specialists as well. How we're brainstorming into how we combat this, how we make the priority go back again, like to focus on women and girls, how we integrate different programmings. We had a fruitful brief discussion about how we embed health, reproductive health within gender-based violence, how that will look like, how can we advocate more towards these kind of ways, like to have more funding for women and girls in the future. And yeah, thanks everyone. It was enlightening to me, and I hope like to attend like the rooms with Malika and Stephen, like to listen to their discussions as well. And thank you for having me. Yeah.
Awesome. Great to have you, Noof. Stephen, you're next.
Hi, yeah. Yeah, that was a lot of fun. I think the two things that came out kind of in each breakout room were the whole issue of trust, how to generate trust between local people working and funders, potential funders, and so forth. You know, how to, offer people what they need in order to trust the work that you're doing and so forth. Which is really an important issue. And the other one was the role of men, in which I was saying that sometimes in these meetings, I feel like I'm the only man there, but at least one other guy showed up. And so that was nice to see, and the importance of men getting involved in completing the panorama on these issues, because they really have to get involved to make this complete. And I think a lot of it is just a lack of education, a lack of awareness about what's going on. And I think a lot we can with that, providing that, a lot of progress can be made. So thank you. And thank you all for listening to me.
Awesome. Thank you to all of our speakers. I would like to open up the floor for anyone who might have a pressing comment or question before we move into our closing activity. Does anyone have any comment or question that is pressing? You can unmute and ask the question to our speakers, or just make a comment to the group. That is welcome at this time. I'll pause for a second to see if anyone would like to speak up. Otherwise, we can start our closing reflection. Okay, since there's no pressing questions or comments, I'd like us to take a moment of reflection to just think about our time today, the fruitful discussions we've had. There are many discussions that we can have and brainstorms, but unless we really allow our minds to reflect and understand what we took in, what our takeaway from it is, and what our personal call to action is, there won't be change done. And so I'd like to take a time to just reflect. And as you reflect about our time together and what the discussions were, what you're taking away from today's session, I'd like you to add it to the chat. If it's a word or a phrase, what is your takeaway or call to action from today? So if we can all please take a few moments of reflection and pause, and then we can start adding to the chat. As the chat is starting to come in, some of the words that are coming in are gratitude, GBV is a health issue, tolerance, coalition building, reinforces my commitment, broader awareness, unity, take action, join forces for women and girls, perseverance, social norms take time to change at a societal level. GBV cannot be secondary. These are all great.
I like that global. Ariette, did you come up with that? Global meets local? That's
I love
awesome.
that.
I actually
That's
did
great.
not. Malika introduced me to that. I love it.
Thank you.
That is a great one. Global. Okay.
What's that one? Repeat that one
Global,
again.
the combination of global and local. We can't do one or the other. They're both really sort of intrinsically intertwined.
Great. That's exactly right.
Okay, great. Well, these are all really great, reflections. It's a well-known term with development global. Awesome. Yes. Well, as the reflections are still continuing to come in, I just want to take this time to say thank you to everyone. On behalf of GlobalWE, I'd like to express our deepest appreciation to our panelists for sharing your expertise on the essential work for women and girls that do in so many parts of the world. The Discussion Circle series is one of the several types of programs that Harvard GlobalWE provides, including an annual Women's Empowerment Expo, an alumni student roundtable. We do movie clubs and a fireside chat series. We value your engagement with our organization as well as your continued support to make events like this possible. Harvard GlobalWE is a registered 501c3 organization, and your donations will be tax deductible in the US. And I'd like to thank everyone for joining today. Hopefully you all feel we've met your goals today and engaging through education, dialogue, and connection. The topic for today's event was suggested by attendees such as yourself at our fall member social. If you have an idea for a topic, an upcoming discussion, or feedback about today's event, please send an email to my co-chair RuPaul. Her email will be in the chat. And finally, I'd like to share some announcements before we close. First, we have a new WhatsApp group for our members, the details of which have been shared in an email. Please feel free to join the group to stay tuned with all of our upcoming events and volunteering opportunities. Coming up soon, our movie club next month on February 6th and 7th, where we'll discuss the documentary Girl Rising. In March, we're excited to present our new essay contest website that allows users to examine and analyze data we've collected over 10 years from the essays submitted by high school students from all over the world. You'll also be hearing from some of the contestants and the team members who make the contestants happen. In April, we will host our 2026 Expo live on Harvard campus on April 18th and virtually on April 25th. We will send out info and ways to get involved through email in the next few weeks, so please stay tuned for that. If you're already not a member or alumni of GlobalWE, we'd like you to join us to receive our monthly newsletter, our program emails. So please visit our website to do so. You can also check out volunteer opportunities on our website. I would love to have you more involved with us. Thank you again for your participation, and I hope that you have a wonderful rest of your week. Thank you again for joining.